Hello, I'm April Johnson and this is my transfer video. So the purpose of this video is to demonstrate how to safely complete bed mobility and transfers. So we're going to be doing a supine to sit transfer, and the purpose of that is just to safely assist the patient from the supine position to roll them onto their side and to get them to the seated position and be able to balance on the side of the bed. Then we're going to do a stand pivot transfer. And the purpose of that is that the individual may be able to support themselves while standing, but they are too weak to move from one area to another. So that type of transfer will be ideal. So let's get into the video. Good afternoon, Mr. David. How are you?
I'm doing good.
That's good. So today we're going to be doing a transfer from the bed to this chair. So we're going to get you from the supine or lying on your back position to sitting up here on the edge of the bed, which we just call a supine to sit. Then from there, once you're on the edge of the bed, we're going to do stand pivot transfers. Just I get you to standing position, and I'm going to help pivot you around to sit here in the chair, okay? So, are you ready?
Sure.
Okay, well, we're going to begin. So, first, I'm going to have to bring your knees up just like this. Okay? Now, I'm going to take this arm and I'm going to cross it over your body, just like this. And then from here, I'm going to roll you onto your side, okay? I'm going to place a hand here on your hip and another here behind your shoulder just to guide you over to the rolling. Okay, now from here is where I'm going to take your legs and just swing them off the side of the bed, just like this. Okay, so here I want you to place your hand flat onto the bed and then place this arm with the elbow here. So you're just going to use this to push up while I pull you up, okay? Okay. On the count of 3, I'm going to lift you up, okay? Okay, 1, 2, 3. Okay. Just keep your hands here at your side, just to keep you nice and balanced. So from here, I'm going to put the gait belt on. So now we're going to put on the gait belt. Just going to put it over the client like this, and we're going to put it at about waist level. You want to make sure that the teeth of the gait belt are facing forward. So then you're going to take the strap, stick it through the back like this. Put it nice and snug, not too tight, not too loose. Should be able to fit at least 2 to 3 fingers underneath. And we're going to slip this through just like this, and then get the excess out of the way. We're just going to tuck it into the belt just like this. Okay, now let me just assist you and slide you up a little bit to make sure your feet are nice and flat on the floor. All right, I'm going to bring this chair in. Okay. All right, so from here, I'm going to get you to stand up, and then we're going to just pivot you around to this chair, okay? So just use your hands to assist me to push up a little bit, okay? We're going to do it in count of 3. Okay, ready? 1, 2, 3. Okay. Now we're going to just rotate around. All right, with this hand, just reach back and feel for armrest and just lower yourself down. Okay, great. Okay. Now you can just rest, and now you're seated. So we're just going to go over what we did again. So we did a supine to sit transfer, which is just getting you from the lying down position and rolling you onto your side and getting you to a sitting position. Then we did a stand pivot transfer, where you just got you to stand up and then pivot around to the chair. Some safety things to remember about bed mobility or supine to sit is just make sure to keep your hands at your side while you're sitting to keep you nice and balanced, and to make sure you have a gait belt on. And then from there, another thing to remember for safety from the stand pivot transfer, just ensure that you have the gait belt on also to prevent falls. And for me, the OTA, just make sure I keep my knees bent, or anyone who's helping with the transfer, keep your knees bent and to lift with your knees and not your back to avoid injury, and just guide the patient throughout the transfer, just letting them know what we're doing. And yeah, that's everything you need to remember. So thank you for letting me assist you. And if you have any questions, you can ask me, the OTA, or you can ask the OT, and we'll be happy to assist you. So thank you for letting me help you again today, and I hope to work with you again in the future.
Thank you.